Now, the World Health Organization says the coronavirus pandemic is having a knock-on effect on other vital health services on the African continent. This as countries are forced to redirect already stretched resources to fighting the pandemic. For more on what is happening on the ground, I'm joined by Mr. Charles Mwangi Waituru, Policy and Advocacy Advisor at the organization Voluntary Service Overseas. A very good afternoon to you, sir. Why would you say are the reasons why the African continent is finding itself under so much pressure in the wake of COVID-19?
Good afternoon. The COVID-19 has come at a time when the African health system is quite weakened by a number of factors. One of them is lack of personnel. The second one is resources and also capacity in terms of being able to reach some of the vulnerable. So as a result of that, quite a number of the services that are offered, which are essential services, sexual reproductive health, nutrition, including immunization, were very badly affected by the coronavirus.
So does this mean that because funds were not being directed to these particular areas of health, that they have been severely compromised?
Yes, when coronavirus broke out, one of the things that happened is that quite a number of facilities were repurposed. So facilities, for example, dental and eye units were converted so that they could be used for the purpose of fighting coronavirus. The second factor that happened was that all the attention was focused on the fight against corona, and therefore all the resources were directed towards development or purchase of PPE for the health personnel. That was not the only factor that contributed to disruption of essential services. There was also the demand side factors where people were afraid to go to health facilities because they feared that by going to the health facilities, they could contract coronavirus. So there were both supply and demand side factors that inhibited provision of essential services. So even health facilities themselves, they were fearful, the personnel were fearful of delivering services because government took time to be able to develop the necessary guidelines and to support the health personnel in continuation of essential services that had been built over many years.
And what ought African governments and healthcare systems do? What do they need to put in place to ensure that they realign their healthcare services post-COVID-19?
One of the things that we have done as an organization, VSO, working with the World Health Organization Regional Office and other agencies within the East and Southern African region, we realized, and from lessons that we learned from the fight against Ebola, is that when there's disruption of services, the number of deaths could actually be more than the deaths that are a sort of coronavirus. And therefore, we developed guidelines for continuation of essential services. Those guidelines identified a number of essential services that needed to continue in order to make sure that we reduce the impact or the secondary impact of coronavirus. Those guidelines, we shared them with the countries in the region, and we had what we call deep dives. We had meetings with each of the Ministry of Health, and we asked the Ministry of Health to do three things. Number one, to have a standalone pillar on continuation of essential services. And number two, to make sure that there was monitoring of the continuation of essential services and reporting of the same. And number three, that there was leadership in making sure that community engagement and participation was also assured. So that is one of the things that African governments have done and they are continuing to do to make sure that those services that could be very detrimental or could have negative effects on health systems continue to be provided even during this time of coronavirus.
And how ready are we as a continent to deal with future pandemics, whether they be of a SARS nature or not?
One of the things that has happened or we have realized as an organization, VSO, is that the sector of the health system is heavily dependent on volunteers, the community health volunteers, those who are deployed by partners and those who are deployed by the government or the health system itself. And therefore, the outbreak of coronavirus has taught us to develop new tools and new ways of engaging and deploying volunteers. So for future pandemics, there are lessons that we have learned, there's a level of preparedness that we have acquired, and therefore in future we'll be able to deploy volunteers much faster and to equip them to be ready to respond at a faster speed than we have done currently.
Well, we certainly hope that that will be the trend moving forward. I guess one can never be prepared enough for a pandemic. It doesn't quite announce its arrival when it does strike. But we thank you very much for your time, as well as the research and the findings that you've made regarding healthcare on the African continent in the wake of COVID-19. That's Mr. Charles Mwangi Waituru there on the work that is being done on healthcare and the coronavirus in South Africa.